Hello, I am Dr. Sanjay Panikar. I founded Amrita Homeopathy in 1997. We are placed in two locations, Koramangala and Marathali. We specialize in hair and skin problems, respiratory problems, pediatrics, allergies, and infertility. Very often people are told that migraine is an incurable type of headache. But that has not been my experience. I have seen that migraines get cured, and homeopathic medicine is being excellent in curing migraines. I have my own relatives who were suffering from migraine and had taken a lot of allopathic painkillers for years together, 10 years, 15 years, and then finally they've come out of all of that with homeopathic medicine itself. Usually when a patient presents, he presents a group of symptoms. Either he has a classical migraine where one half of the head is paining and he has some visual symptoms, and then he has a nausea, vomiting sensation subsequent to that, which relieves his headache. So we have to look into the kind of symptoms that the patient presents with, like where is the location of the headache, where does the headache start from, where does it end. Like in each patient the presentation is different. There are patients who have a headache which starts in the back of the head and settles in the eye. There are patients who have headaches which starts in the eye and settles towards the back. There are also patients who have a left-sided headache. There are patients with a right-sided headache. I have a patient who has a blurring of vision which comes up typically just before the headache, and as soon as the headaches progress, as the headaches starts increasing, the blurring starts reducing, and after some time there's no blurring, the headache is very bad. This is a typical symptom of a medicine called as iris versicolor, and after prescribing iris versicolor, the patient has no more headaches now. So that is the kind of response that we get in migraine if we identify the right remedy. There are other excellent medicines. The most common medicine any homeopath would use is belladonna. Belladonna is a good medicine where there is congestion of the whole face, especially of the right side, where there are right side of throbbing headaches, and every homeopath must have used belladonna at least once. So it is impossible that a homeopath can practice without belladonna. That's what I think. So belladonna is very major and important remedy for migrainous headaches. And after belladonna, the pain comes down maybe within half an hour or 45 minutes or 1 hour. And once the pain reduces and it is keeping on recurring again and again, we need to complement belladonna with certain complementary medicines. Complementary medicines are those which completes the action of the given medicine which has worked and given relief. Calcarea carb, sulfur, natronure, and other medicines can be complementary to belladonna. Based on the symptoms, the complementary medicine is selected and given to the patient. Subsequently, when the patient uses these medicines regularly on and off for a long period like 6 months or maybe a year or year and a half, the migrainous headaches eventually disappear. Initial phases the patient experiences is the frequency of the requirement for painkiller keeps coming down. Not that today you start this and tomorrow you won't need any painkiller. That may not be practically possible because you are so used to the painkiller when you come to us that the medicine is going to help you to come out of the painkiller gradually but not suddenly, that you start this and tomorrow you stop all your painkillers. May not be practically possible. So but over a period of time patients do stop painkillers and do come out of the migrainous headaches too. Arsenicum album is another excellent remedy where the patient experiences a lot of weakness. We often see in the clinics that the patient comes with a bystander or somebody to support the patient, and the patient is so weak and exhausted because of the headache that somebody has to support the patient. Cocculus is also another remedy with such extreme weakness during the headache, where the patient can hardly stand and somebody is there to support the patient. Where the patient has been sleeping and suddenly somebody woke the patient up from sleep and the headache has started, Cocculus could be one of the most important remedies. Again, you have medicines for headache like Silesia, where the patient is typically a schoolboy or a school child who has been having headaches which usually settles across over the region of the right eye. They are right-sided headaches which starts in the back of the head and settles over the eye. So Silesia is very important in this. Spigelia is another medicine which has again headaches, but they are left-sided headaches which starts on the left eye and then spreads backward. So when you give Spigelia for such a case, it immediately relieves the headache within a couple of hours and the patient is much better.